Hi, Miss Nikki here. Welcome to Chapter 22. We're going to talk about some respiratory anatomy. First, we have to talk about the major functions. So we know the respiratory system is designed to supply our body with oxygen and dispose of the CO2, which is a waste product of cellular respiration. They want to make sure you understand that respiratory, cardiovascular, and lymphatic are all closely coupled. So we're going to talk about cardiovascular and the bicarbonate buffer system and how that's linked to respiratory. Some definitions that you should know: pulmonary ventilation, which is breathing. That's just the actual movement of air in and out of the lungs. And then we have external respiration. This is gas exchange at the lungs, right? So when we breathe in, when we do pulmonary ventilation, we breathe in air, we take the oxygen, we transport it into our bloodstream via our lungs, and we exhale CO2. Transport. How do we transport the gases? Well, obviously that's in our blood and our cardiovascular system, right? And then our internal respiration. This is where we are exchanging gases at the tissue level. So we talked about this before, where we have a capillary bed and we push the oxygen to the interstitial fluid, and then that gets brought in to the tissue, and all of that is directed by that hydrostatic and osmotic pressure that we talked about. So here's a list of the major organs. We're going to go over each. This is a nice image to see the nasal cavity. It shows the pharynx. So the pharynx is the tube that runs behind the nasal cavity down to either the anterior side, which is the larynx, or the posterior side, which is the esophagus. So it's really hard to see the esophagus in this image. Then we have our trachea. Then we have our right bronchus, which leads to our right lung, and then we have our left bronchus, which leads to our left lung. And you can see here that the lungs sit on top of the diaphragm. So something that I want to point out, you should be able to look at the flow of air. So if my mouth was closed and I was breathing in through my nose, air would go nasal cavity, it would travel the pharynx, and then air would switch over here to the larynx, and then air would go trachea, bronchus, lungs, and then eventually all the way out to the alveoli that we'll talk about. This is just a list of the functions, right? So it's an airway for respiration. Probably something we haven't thought about is that it moistens and warms the air as it enters. We also filter and clean the air. We have mucous membranes in the nose, and we also have cilia or hair, right? Serves as a resonating chamber for speech. I'm sure we've all plugged our nose and tried to talk, and it sounds a little different, right? So the nasal cavity actually contributes to speech. And then we have olfactory receptors. You may remember this from 201. We talked about our olfactory cranial nerve, and that innervates through the cribriform plate into the superior portion of the nasal cavity. Nasal septum is going to divide the nose midline. You have a nasal vestibule. This is the nasal cavity, the superior portion to the nostrils. Nares or nares. Vibrissae are the hairs. We have hairs in our nose, right? And their job is to trap any coarse particles in the air that we're breathing in. And then we also have mucosal membranes. So these are going to produce mucus to attract and bind any particles in the air that we're breathing in. Specifically, you might remember these terms, that in our respiratory mucosa, we have lysozymes and defensins. This is kind of our first line of defense. You remember kind of that inherent or kind of passive line of defense, and mucous membranes were one of the ones that we discussed. So we know the nasal cavity have cilia. They're going to sweep. We also have mucous membranes, which are going to produce a sticky secretion to trap any particles that we happen to be breathing in. We also are going to warm the air. As we breathe in through our nose, we're warming the air before it hits our trachea and our lungs. If you've ever run outside when it's cold, there's a big difference between having your mouth open or your mouth closed, right? If that cold air, if you're breathing in through your mouth, that cold air hits the lungs, it almost hurts, right? The nasal conchae, those are the bones. If you remember your superior, middle, and inferior nasal conchae bones from the skeletal chapter, those are there for a reason. Those bumps in your nose, they're there to filter and heat and moisten the air before it hits your trachea and your lungs. We're not going to talk too much about the sinuses, but they're there to lighten the skull. If your sinuses were filled with bone, your face would be heavy and it would be hanging down a little bit more. So here's a great image. We can see our superior, we can see our middle, and we can see our inferior nasal conchae. This whole cavity is the nasal cavity, and it's lined with a mucous membrane and cilia. You can see the nostril, or the nares, the N-A-R-E-S. And then we have the back posterior part here, which is the pharynx. And you can see that it's been divided up into sections. So here's the nasopharynx. The nasopharynx is everything behind the nasal cavity. The oropharynx, that's this tube section behind the oral cavity. And then the laryngopharynx is here, and the laryngopharynx is directly posterior to the larynx. And here's a better view of the esophagus. You can see esophagus on the posterior and trachea on the anterior. Here's a cadaver image if you want to take a look. Obviously not as pretty as our nice model picture, but I still think good to look at. You can have inflammation of these mucosal membranes, right? So if the nasal mucosa is infected, it is continuous with the respiratory tract. So you can have an infection that's in your nose and you can have it spread to your throat and your chest. This is also how infections set in, right? If you're breathing in, somebody's coughed on you and you breathe it in through your nose, that bacteria or virus can still set up shop in your chest. Okay, let's see. Oh, pharynx. We've kind of already covered this. Here's a color-coded section if you want to see nasopharynx, oropharynx, and laryngopharynx. Here are some of the items that are in the nasopharynx. So it's telling you that it's an air passageway. It's telling you it's lined with pseudostratified columnar epithelium. You remember these are the ones that were ciliated. There's the soft palate with the uvula. That's the structure that hangs down in the superior portion of your oral cavity. We have the pharyngeal tonsil, and then we have the pharyngeotympanic tube. We have the oropharynx. Inside the oropharynx, you have the palatine tonsils, and you have the lingual tonsils. In the laryngopharynx, we want to make sure that we realize this is a passageway for food and air. All of your pharynx really is for food or air. And that we have this structure called the epiglottis. So here's our nasopharynx, this area posterior to the nasal cavity. You can see up here we have the pharyngeal tonsil. Here's the uvula. This is all called the soft palate. So you see how it's pink? That's all soft palate, and the uvula is the structure that hangs off of the soft palate. And you can see, when my mouse starts acting right, there we go. You can see the uvula is the little dangly part that you see when you open your mouth. And then here is the hard palate. The hard palate is your palatine bone. And you can see in the oropharynx now, we're looking at this block behind the posterior or behind the oral cavity. You can see the palatine tonsil here. And you can see the lingual tonsil here. Now we have our laryngopharynx. You can see the flap here, which is the epiglottis. So what this flap is going to do is close. Let's see if I can get this pen to work. Maybe, we'll see. So what's going to happen is this flap, nope. Go, do what I want you to do. Pen, thank you. This flap right here is going to close off this section of the larynx. So remove that, go back to automatic. This right here is the larynx, all of this. That epiglottis is going to close when you swallow so that food can only go down the esophagus. So while we're here real quick, let's just make sure that we understand the pathway of air versus food. So if I breathe in through my nose, right? If I have air, let's try this pen thing again, see if I can get this right. Pen. Let's pick a different color. So if I have air coming in through the nasal cavity, then the air goes through the nasopharynx, then it goes through the oropharynx, then it goes through the laryngopharynx, and then air has a decision. Do I want to go esophagus to stomach? No, right? I want to go larynx to trachea. What other way can air go? If you're stopped up, right? Your nose is stopped up, I can breathe in through my mouth, right? So oral cavity to oropharynx to laryngopharynx to larynx to trachea. So you have several ways here. All right, so now what color should we use? Let's do blue. What if we're doing food? So hopefully you're not starting here, right? That's a no-go for food, right? We're starting here at the oral cavity. So if we're talking about food, we're going through the oral cavity. Food has to travel in the oropharynx. Then it has to come down here to the laryngopharynx. And hopefully this flap is closed. And if the flap is closed, food goes from the laryngopharynx into the esophagus. So that's why sometimes if that flap doesn't work, if you've ever taken a sip of something, especially carbonated, and you'll get that feeling and you say, oh, it went down the wrong tube and you're choking and trying to cough things up, right? That meant there was something that didn't quite work right with your epiglottis, and a little bit of fluid has managed to make its way into your larynx and your trachea, and you're trying desperately to cough that up. So we know that we can remove tonsils. So the pharyngeal, which is also sometimes called the adenoids, they can block air passage. Remember that pharyngeal tonsil is in the nasal cavity. And if it gets really, really large, it can block part of the nasopharynx and the oropharynx and make breathing harder, right? So now we move to the lower respiratory system. We're going to talk about the larynx, the trachea, the bronchi, and the lungs. And they divide up lower respiratory into the respiratory zone, which is actually the site of gas exchange. Now my mouse doesn't want to work. There we go. So site of gas exchange is the respiratory zone. The conducting zone, this is how do we get the gases to the site to exchange them. So the larynx, this is important here. We're providing a patented airway. So I just want to make sure that we understand patented airway. So patented airway means that it's always open. We do not want to impede our pulmonary ventilation, right? So breathing air in, we want to make sure that that's always open. So again, here's a highlighted section of where the larynx is. You can see the flap, which is the epiglottis. We're not going to name all the cartilage. I just wanted you to see that there are several cartilage rings, and these are what are going to stop this area from collapsing, right? These are rigid structures. You'd have to have a lot of force in order to collapse these and block somebody's airway. So here's a nice sagittal section. You can see here the epiglottis, the flap, right? You can see the hyoid bone. You can see the entire larynx. And then we're going to talk about some of these structures, the vestibular fold and the vocal fold. These are responsible for generating speech. So here I have highlighted true and false vocal cords, but you do need to know these terms as well. So you need to know vocal folds and you need to know vestibular folds. So something to note here, the vocal folds, the true vocal cords, they're going to vibrate. And they're the structure that actually produces sound as air rushes in. The vestibular folds play no part in sound production. They help open and close the glottis during swallowing. So here's a better image. The white here, you can see the white is the true vocal cord, and these folds next to it are the vestibular folds. So remember what I said, the vestibular folds, all they do is control whether the glottis, which is the opening, opens or closes. So the vestibular folds are like muscles, and they decide whether you're going to have an open or closed glottis. And then as the air rushes through, the air vibrates these white true vocal cords, and that's what produces speech. I'll let you look through the voice production. It just gives you some definitions about what's pitch, what's loudness. Laryngitis. You can also have an inflammation in your vocal folds, right? They can cause them to swell. They can interfere with the vibrations, and then this can change your speech, right? Make you sound hoarse, right? Create speech that's almost at a whisper level. So now we move on to the trachea, right? So we're not going to call it the windpipe anymore. And the trachea goes from the larynx into the mediastinum and divides into two main branches or bronchi. We're going to have the right bronchus and the left bronchus. So the US is singular and I is plural. And then we're going to talk about 3 layers again. So kind of common, right? We always have an epithelium layer, and then we have a connective tissue layer, and then we have an outer connective tissue that almost acts as like a fibrous connective tissue. We'll also talk about this trachealis muscle that we have, and this carina. This is the last tracheal cartilage. So here in the posterior section, we have the esophagus. Then we have this trachealis muscle. Then we have the mucosal membrane. And remember, that's going to have ciliated, pseudostratified columnar epithelium. Then we have this submucosal layer. This is connective tissue, but it also has mucus glands. We also have mucosal cells in this inner mucus layer. So we've got cells here producing mucus. Then we've got glands producing mucus in the connective tissue. And then we have this cartilage ring. Can you see how this provides a patented airway, an airway that's always open? Okay, good. What I think is interesting about this trachealis muscle here is that you can see that there's no cartilage here, right? So if you are consuming food here, if the piece of food is too big, you can actually press and move this section. So let's say I have a really large food particle. You can actually press into the trachealis muscle and move that structure out into the lumen of the trachea. But you have to be careful because you might be cutting off some of your airflow, right? And this is how food can get stuck, right? If you eat something too large, if you don't chew well enough, you could eat a large chunk of meat, let's say, and it could get lodged and it could block off part of the lumen of your trachea that's supposed to be your patented airway. And then you'll see in a later slide, we talk about the Heimlich maneuver. So again, here's our nasal cavity. You can see our pharynx. Then we have our larynx in the anterior section that leads to the trachea, which leads to the right and the left bronchus. Or we can do nasal cavity, pharynx, and lead to the esophagus on the posterior side. We do talk about cilia when it comes to smoking. Now with coronavirus, we have new ways to talk about cilia, right? So the virus is destroying the cilia, just kind of like smoking destroys the cilia. And if you don't have these cilia, cough is the only way to prevent mucus and fluid from building up in the lungs. So if you get rid of the cilia, you can't sweep out any debris or particles that happen to be in your lungs. Here's where we talk about the Heimlich maneuver. So having any sort of tracheal obstruction. So if you're eating a piece of food and that food's in your esophagus and it pushes into the lumen of your trachea and that causes an obstruction, it can prevent you from doing pulmonary ventilation or breathing. So let's look at the bronchi and the subdivisions here. It's better if we just look at the images, I think, than going through some of the wording here. So here's my trachea. Here's my right bronchus. Here's my left bronchus. And then they'll talk about secondary bronchus, tertiary bronchus. They're talking about branching. If this is the first branch, it's the primary. And then off of the primary, do we have secondary branching? Yes. Then off of the secondary branching, do we have tertiary branching? Yes. What I want to focus on is trachea, right bronchus, left bronchus, and then all of these little tiny endings. Those are all bronchioles. And you remember the ending, right? When we had artery and arterioles, arterioles were just smaller arteries. Well, bronchioles are just smaller bronchus, right? Here's a nice image that's color-coded for you so that you can see how much branching we're talking about. So to me, this looks like a root system, right? So at the end of all of these tips here, at the end of all of the bronchioles, we're going to see sacs. And those sacs are where the gas exchange actually happens. So that's something I want to point out in this image. Do you have gas exchange at the trachea? No. That's why this is the conducting zone. All we're trying to do is get the air in or get the air out. When we get out here to the bronchioles and we look at the alveoli sacs, that's where we actually have gas exchange. That's where the oxygen is coming in and the CO2 is being kicked out.